For COVID-19, the biggest killer is complacency, and the most important risk factor is inaction. The disease has spread extremely rapidly and is wreaking a devastating impact on overburdened and underprepared healthcare systems. After hitting China in late January, COVID-19 has now been officially declared a pandemic by the World Health Organization.
Let me begin, as always, by saying that according to all of the experts gathered here and on our task force, the risk to the American public of contracting the coronavirus remains low.
The vast majority of Americans, the risk is very, very low. Young and healthy people can expect to recover fully and quickly if they should get the virus. The highest risk is for elderly population with underlying health conditions. At the very start of the outbreak, we instituted sweeping travel restrictions on China to keep new cases from entering our shores. We will be suspending all travel from Europe to the United States for the next 30 days.
Today, I'm declaring a state of emergency in Massachusetts. This declaration will give our administration more flexibility to respond to this evolving outbreak.
That this is not just your ordinary flu. This is a virus that the experts tell us are at least 10 times more potentially fatal than the flu.
We will be talking about school closings in that area. We have closed the schools now. The question will be duration, but we could be talking weeks.
This is now not just an attempt to contain the disease as far as possible, but to delay its spread and thereby minimize the suffering. The most important task will be to protect our elderly and most vulnerable people during the peak weeks when there is the maximum risk of exposure to the disease and when the NHS will be under the most pressure. From tomorrow, if you have coronavirus symptoms, however mild, either a new continuous cough or a high temperature, then you should stay at home for at least 7 days to protect others and help slow the spread of the disease. We are considering the question of banning major public events such as sporting fixtures. And the scientific advice, as we've said over the last couple of weeks, is that this banning such events will have little effect on the spread. But there is also the issue of the burden that such events can place on public services. So we're discussing these issues with colleagues in all parts of the United Kingdom and will have more to say shortly about the timing of further action in that respect. We are not, repeat not, closing schools now. I want to stress something that's very important in the wake of what we're saying this afternoon. I urge people who think, in view of what we're saying about their potential symptoms, that they should stay at home. I urge them not to call 111, but to use the internet for information if they can.
La fermeture des crèches et des établissements scolaires dès qu'une zone devient à circulation virale activée. Envoyer ses enfants à l'école n'est pas dangereux pour les enfants en soi, mais fermer les écoles, fermer les crèches lorsque le virus circule beaucoup permet d'avoir un impact sur la progression virale dans le territoire. À l'échelle nationale, tous les rassemblements de plus de 1000 personnes sont désormais interdits.
De continuer à faire des sacrifices et plutôt d'en faire davantage, mais pour notre intérêt collectif.
And
Dès lundi et jusqu'à nouvel ordre,
as of Monday,
les crèches, les écoles, les
schools,
collèges, les lycées et les
daycare
universités
centres, universities, high schools will all be
pour une
closed.
raison simple.
And this is for a very simple
Nos enfants et
reason.
nos plus jeunes,
Our children, the most
selon
young
les scientifiques, toujours,
people of this nation,
sont celles
again
qui
according to
sont-
scientists,
propagent,
are those people
semble-t-il,
who
le
are
plus
most likely
virus.
to
Même
spread
si pour les
the virus
enfants,
at such a
ils
fast
n'ont
rate.
parfois pas de symptômes.
Now, while children may not have any
Et
symptoms,
heureusement, ne semblent
and
pas aujourd'hui souffrir
it seems to
de
be,
formes
for the time
épidémiques.
being, that they don't suffer from the most
C'est à la
serious
fois pour les
versions
protéger
of the
et
viral
pour
disease.
réduire la dissémination
They
du
spread
virus
it.
à travers notre territoire.
And this is, in closing these schools, this is a way of stopping the spread across France of the virus.
Morning breaking over Milan. By the time people woke up here, normal life had been suspended.
Dramatic move. The government here has ordered the closure of all schools and universities across Italy until at least mid-March, and is warning people to avoid mixing with large crowds. That's already having an impact on major sporting events. As football stadiums in big cities were being disinfected, it was announced England's final Six Nations rugby match against Italy, scheduled for next week, has been postponed.
Is because of the vast amount of testing. More than 200,000 people tested in this country already. 650 places throughout the country where you can be tested between hospitals, clinics, and these pop-up drive-through centers.
COVID-19 is a disease with many similarities to seasonal flu in terms of its symptoms. However, its infectiousness, the lack of herd immunity, and significant differences in transmission dynamics means that COVID-19 has a far higher mortality rate than normal flu and a far greater capacity to overburden healthcare systems. It is a disease that demands huge respect.